Long time no see, this is YouTube Medical University. Lately, I haven't felt confident and find intimate moments at night a bit of a hassle, but I don't think it's serious enough for a hospital visit. Also, ED medication seems kinda scary. I've even heard that it's bad for your heart. This video is for people with those concerns. These are by no means uncommon concerns. And recently, haven't you seen ads and videos like this on social media? ED medication to take every day. Daily Tadalafil. You're interested, but you don't know what to believe. I think there are a lot of people like that. Hello, I'm Dr. Yu, a general practitioner also known as Dr. Mandoline. Honestly, the information about ED on the internet is a mix of good and bad. That's why today, I'll be talking from a doctor's perspective based on data. By watching this video, you'll get answers to all these questions. What kind of medicine is it in the first place? How effective is it? Is it really bad for your heart? What benefits does it have besides helping with erections? And in the end, is it suitable for you? By the time you finish watching, you'll know whether this is right for you or not. On the other hand, if you have symptoms but leave them untreated, what will happen? Your worries and doubts will quietly continue. And not only that, but it also means missing important warning signs involving the blood vessels and blood flow behind these issues. So I hope you'll use this concern as an opportunity to address the underlying blood flow problems and take early action. So today, in the first part, I'll talk about what kind of medicine Tadalafil is. In the second part, I'll explain what gets better if you take it every day. And in the third part, I'll cover the correct way to take it and common misunderstandings. And in the fourth part, I'll talk about whether it's right for you and how much it actually costs. Please watch, even if it's only the parts you care about. First, what kind of medicine is Tadalafil? By the way, this is what the actual tablet looks like. It's tiny, and you take one daily. That's all. To put it simply, it's a medicine that switches on your blood flow. So, what exactly happens with ED? An erection is a phenomenon where, due to sexual stimulation, the blood vessels relax and a large amount of blood flows in. The switch that relaxes these blood vessels doesn't work properly. That's the true nature of ED. Let's compare the mechanism to a car. Relaxing the blood vessels and allowing blood to flow is like the accelerator. Inside the body, a substance called cyclic GMP is pressing this accelerator. There's also something that acts like a brake, easing off that accelerator. This is an enzyme called PD5. Tadalafil suppresses the function of this brake enzyme, PDE5. It gently releases the brake. Then, the accelerator works more easily and blood flows in more easily. This is how the medicine works. However, what you need to be careful about is the initial trigger to press the accelerator. That trigger is still sexual stimulation. The medicine is only releasing the brakes. Without stimulation, the accelerator won't be pressed. A key trait of this medicine is the duration of its effectiveness. It is said to last up to about 36 hours. By the way, this PD5 inhibitor was originally developed from research on the heart and blood vessels. That's why it has several uses, not just for ED. One of them is urinary problems caused by prostate diseases. And another one, surprisingly, is that it's also used for pulmonary hypertension, a disease of the blood vessels in the lungs. The same active ingredient is used under different names and is effective in each of these areas. By now, I think you have a general idea of the characteristics of these medications, but a common concern is that many people don't know which ED treatment to choose, so I'll explain the other medications in an easy to understand way as well. The most common question is, how is it different from Viagra, which has been used for a long time? Actually, there are three main types of ED medications. The first one is sildenafil. This is a medication known by the name Viagra. It's the oldest medication, so extensive data has accumulated from long-term use. It lasts about 3 to 5 hours. It's a type that has a strong effect for a short time. Since it's easily affected by food, the basic rule is to take it when your stomach is empty. Second, vardenafil. It's a medicine called Levitra. This one is also short-acting. It's no longer sold under the name Levitra, and in Japan, it's used as the generic drug vardenafil. And the third one is Tadalafil. This medicine is also known by the name Cialis. This type works more gently and lasts longer. The duration of effect is up to about 36 hours. Moreover, it's less affected by meals. So while all three are technically the same type of medicine, the way they work and their characteristics are different. It's not about which one is superior. It's just a matter of whether it's better for the medicine to work strongly for a short time or to work gently over a longer period. It's simply a difference in their properties. Among these, the property of Tadalafil to have a gentle effect over a long period is utilized in the daily Tadalafil regimen, where you take a small amount every day. Doesn't that make it easier to understand? So, let's get to the main topic of this video. What are the benefits of taking it every day? First, let's talk about its effects. Tadalafil has been shown in clinical trials to clearly improve indicators of erectile function. This has also been confirmed with the daily dosing regimen. A study tracked people taking it daily for 6 months. In that study, more than 90% of people reported improvement in their erections. Let me discuss topics besides erections. Tadalafil basically works by affecting blood flow. That's why it's also used for urinary problems and prostate symptoms I mentioned earlier. In other words, it's easy to understand it as something that boosts the overall condition of the lower body. Now, on the internet, some people say that daily Tadalafil can rejuvenate blood vessels or has anti-aging effects, but to be clear, we can't say that for sure yet. There are indeed some studies. There is data from 2007 and 2018 showing that blood vessel test results improved, so we are looking forward to future research. However, in the current research, the test results are improving, but that doesn't necessarily mean it makes you younger or that you'll live longer. However, with these kinds of effects in mind, a lot of research is still being conducted, and this medication called Tadalafil is highly anticipated. And how long does it take for the effects to appear after you start taking it? When you take it daily, it takes time for the level in your body to stabilize. It usually stabilizes in a few days to about 2 weeks. So instead of stopping because you don't feel the effects right away, you'll gradually start to notice the benefits. This is a characteristic of this medicine. It's the kind of medicine that works by gradually building a stable foundation as you keep taking it. And one of the main advantages of taking it every day is that you can always get a consistent effect. Taking it as needed is like starting a car engine each time. And the method of taking it every day is like always keeping the engine warmed up. With the as needed approach, you may think there's a chance you'll need it tonight, so you need to take it in advance, anticipating that. However, it's often hard to predict in advance when that will happen. On the other hand, there are also many times when you take the medicine but end up not having the opportunity. And figuring out exactly how many hours in advance you should take it, having to calculate that every time. I'm sure many people find that troublesome. In that respect, taking it every day keeps the level in your body constant, so whenever the time comes, you don't have to worry about it. No need to worry about timing. I wonder when I should take it. I forgot to take it. You'll be freed from those small stresses. Many people are happy about this. You don't need to worry about your medication when you're with your partner. Being freed from this routine might be the greatest value of all. Being freed from the small daily stresses makes each day feel just a little bit lighter. This video is brought to you by Suitability. Taking it orally is one of the easy options you can start with, and that's what I'm introducing today, Suitability. Did you know? It's a service where you can receive ED treatment online. There are 3 main features. First, from consultation to prescription, everything can be done with just your smartphone. You don't have to go to the hospital. Additionally, after your consultation, your medication could ship as soon as the next day. You can start as soon as you decide to. That's a big deal. Second, a qualified doctor will prescribe medication after a proper examination. This is a big difference from personal imports where you don't know the ingredients. And third, your order will be delivered in plain packaging. There are no external markings to show what's inside, making it discreet and hard for family members to notice. This daily Tadalafil comes as a monthly subscription for 3,980 yen for a 30-day supply that works out to about 133 yen per day. The online consultation fee, the medication cost, and the shipping are all included, so the total price is about the same as a can of coffee. Now let's get back to the main topic. Now that you understand the value of Tadalafil, let's talk about how to use it. If you get this part wrong, you might think it doesn't work at all, so please listen carefully. First, let's start with the most important point. This is about sexual stimulation, which I mentioned in the first part. This medicine doesn't cause an erection just by taking it. The effect only appears when sexual stimulation turns the switch on. This medicine makes it easier to turn on the switch, but it doesn't actually press the switch itself. If you misunderstand this, you'll be disappointed, thinking it didn't work even after taking it. So when should you take it every day? Basically, it's once a day. You can choose the time that best fits your lifestyle. The key is to take it at about the same time every day, just like brushing your teeth. Taking it after breakfast as part of your routine makes it less likely you'll forget. It's also useful to know how it relates to meals. Tadalafil is not easily affected by food. Even after a fatty meal, it's unlikely to become significantly less effective. How about alcohol? If it's a small amount, it usually won't be a big problem. However, it's a different story if you drink too much. Alcohol itself has the effect of dilating blood vessels, so when combined with the medication, your blood pressure may drop too much. This can cause dizziness or lightheadedness. So be careful not to drink too much alcohol. And if you forget to take it, it's okay to take it as soon as you remember, as long as it's the same day. However, if you miss a whole day, please do not take 2 pills at once to make up for the missed dose. Higher dosages raise the risk of side effects. If you miss a whole day, just skip it and start taking 1 pill a day again from the day you remember. So, from the perspective of whether this suits you or not, I'll share my own opinion as well. Who is daily Tadalafil taken every day best suited for? There are 4 checkpoints. First, people who always want to feel confident in themselves. You want to enjoy time with your partner more naturally. You want to feel confident about your morning vitality again. You want to keep your overall condition on track day to day. Second, people who don't want to worry about timing anymore. It's better to stay consistent instead of worrying about timing or rushing, as it brings peace of mind. This suits people who prefer that approach. And third, people who don't really feel the effects when taking it each time. Changing how you take it may cause a different effect. And fourth, people who also have concerns about urination. This is about the prostate. Tadalafil is originally a medication used for prostate symptoms as well. Studies also show changes in urinary symptoms and quality of life. Just to add, for those with benign prostatic hyperplasia who clearly have urinary symptoms, in this case, a medication with the same ingredient may be covered by insurance as a treatment for urinary symptoms. On the other hand, if you take the medication solely for the purpose of treating ED, daily use is not covered and will be considered self-pay care. The doctor will determine which category you fall into after an examination. That's why it's important to see a doctor first. And as for the side effects, please make sure you understand them. There is no medicine without side effects. At the beginning, there was the anxiety about whether it might be bad for the heart. I'll talk about this as well. The main side effects are caused by the blood vessels in the body expanding and relaxing. For example, some people may experience symptoms such as facial flushing, headaches, palpitations, nasal congestion, stomach discomfort, dizziness, or swelling. Most people experience mild symptoms and often adjust as they keep taking the medication. However, if you are having a hard time, please do not try to endure it. Also, there is one thing to be careful about. Do not stop taking the medication on your own just because you are having a hard time. Please make sure not to do this. There are ways to adjust the dosage and ways to cope with the symptoms, so please make sure to follow the rule of consulting the prescribing doctor first. By the way, one common concern I often hear is, if I take this medicine every day, won't I get addicted to it? But you can rest assured, this medication itself is not addictive. And now, about the heart. For people with a healthy heart, if you use it correctly, there's no need to be overly worried. However, there is something I absolutely want you to follow. That is, if you have a heart condition such as angina. For those who are taking a medication called nitro, also known as nitrates, if you take this together with Tadalafil, your blood pressure may drop too much and it could even be life-threatening. And if you take it every day, when you actually feel chest pain and need the medication called nitro, you won't be able to use it right away. If you have a heart condition, please make sure to tell your doctor about it. And although it's very rare, I'll also tell you about symptoms that if you notice them, you should definitely see a doctor. Chest pain, sudden changes in vision or hearing, and a painful erection lasting more than 4 hours. This is a medical emergency called priapism. Don't wait, go to a medical facility now. And for those struggling with ED symptoms, as a doctor from YouTube Medical University, there's one thing I want to tell you. First of all, ED is not always just a problem on its own. It can also be a sign from your body reflecting the condition of your blood vessels and blood flow. When your blood vessels start to lose their flexibility and become stiff, sometimes the earliest sign of that shows up as ED. So lifestyle habits can also play a role in ED. Exercise, sleep, diet, these kinds of things gradually affect blood flow. If you're struggling with these symptoms, I encourage you to monitor blood pressure, blood sugar, and cholesterol as they can reduce blood vessel flexibility. Please take a look back at your own health checkup results. Not letting these worsen and working to improve them is actually important to prevent ED from getting worse. Don't just give up and blame it on your age. Consider your lower body health as part of your overall health management and take another look at your own condition. Please consider taking that kind of proactive approach. Here's a summary of what we've covered. Tadalafil is a medication that improves blood flow and has long-lasting effects. If you take it every day, you can keep things steady all the time, and you can expect improvement in erectile function. Just taking it won't work. It works when there is sexual stimulation. If used correctly, it's not a drug to be overly afraid of. However, you must never use it together with nitrate medications. Whether taking it daily is right for you depends on how often you need it. It's about compatibility, not which is better. ED is a common sign, and some say about 1 in 3 people experience it. And if you leave it alone, basically it won't go back to normal on its own. If concerned, consult a doctor first. That said, going to the hospital for ED can feel like a big hurdle. It's understandable. Nowadays, you can complete everything from consultation to prescription online. Here, let me address some common concerns. What questions might I get in an online consultation? There's no need to be nervous. Basically, you'll be asked about your current symptoms, any issues you're experiencing, any chronic conditions you have, any other medications you're taking, and whether there are any dangerous combinations like the nitrate medications we mentioned earlier. We'll check your blood pressure and heart to see if the medication is safe for you. I don't recommend deciding on your own to import medication. The quality isn't guaranteed, and in the past, counterfeit drugs have even been found in the country. Some products have unknown ingredients or quantities. Since these are things you put into your body, I strongly recommend seeing a doctor and obtaining them through official channels. That's why the online medical service Suitability ED is convenient. The cost for a regular subscription was 3,980 yen for a 30-day supply. The key point is, the price remains the same after the first time. The consultation fee, shipping fee, and medication cost are all included, so your monthly payments are easy to predict. Terms are listed in the description box. Privacy is also considered, and many people are concerned about it, right? The packaging is plain, making it hard to tell what's inside. Furthermore, even on your credit card statement, it only shows the clinic's name, so you can't tell it's for ED just by looking at it. Now, let's talk about cancellation. It's easy to get started, but quitting can be difficult. Many people feel uneasy about that. With Suitability ED, it's simple. If you complete the procedure from your account page before the next medication is shipped, canceling is easy. There are no costs either. If it doesn't suit you, you can stop, so that peace of mind matters when deciding to continue. I think it's one option to spend time with your partner more naturally and to live each day positively from now on. Don't struggle with it alone. Start with a consultation. This happened in the past. After taking the medication, things changed. Your comments could help others with similar concerns. At YouTube Medical University, we will keep sharing evidence-based information and provide tips to help you get healthier starting tomorrow. If you like it, hitting the like button and subscribing to the channel would really encourage us. If you're not really feeling confident, I hope this video can be a small step toward easing that anxiety. Well then, see you in the next video. I have one announcement for those of you who watched until the end. I've created a place where I can share health information in a more in-depth, interactive way. It's called the Kokokara Mind and Body Consultation Room. Many people tell me they're concerned about their health, but don't know what to believe in the end. At Kokokara, I receive many consultations from how to interpret your medical checkup results and how to deal with medication to caring for your family members. I personally answer each and every question 24 hours a day. If you're interested, please start by registering for the free official LINE account. We send monthly sample videos of member content so you can see what it's like. Recruitment updates are sent first to those signed up for the LINE account. Register using the top link in the description. We look forward to hearing from you.